I'm Dr. Pascal Wilson. I am an oncologist and hematologist with Family Cancer Center. I work at our Oxford, Mississippi location. Nausea refers to the sensation of having an upset stomach or feeling like you might have vomiting or throwing up. There are many reasons a patient with cancer can have nausea or vomiting. A big one has to do with the effects of chemotherapy. Those medicines can cause a person to feel nauseated. But some types of cancer, those that involve the lining of the abdomen or come from the stomach or intestines, can also disrupt normal intestinal function and make a person have nausea. Nausea and vomiting can cause other problems, particularly when a person is getting chemotherapy. For many chemo medicines, we worry about the risk of dehydration after they're administered and worry that things such as kidney problems could happen if a person got dehydrated after getting a chemo dose. Having nausea may affect a person's appetite, may make them less likely to eat, so nausea is certainly something we want to control in patients who are getting treatment for cancer. Many patients have heard of chemo's unfortunate reputation for causing nausea decades ago. But in modern times, we simply do not expect the kind of severe nausea that used to occur. We have good medicines to use prior to chemo administration to prevent most nausea from developing. And for most patients, each time an IV chemo dose is given, the patient will first be administered a combination of several different anti-nausea medicines. With the use of those meds, we just don't expect people to be violently ill anymore. We can still see episodes of mild nausea at home that typically can be controlled with minor tablet medicines that can be taken at home. First thing we tell patients to take care of nausea is don't be afraid to use medicines that have been prescribed. These meds are generally safe when used repeatedly. Many of the nausea medicines we use, different types can be used together, so if your doctor told you to take more than one type of nausea medicine, that's okay. Other things we tell patients are more common sense, to avoid very greasy or very spicy foods while you're getting chemo. Things that might normally have some risk of upsetting your stomach will just be more likely to upset your stomach when you're getting chemo. Beyond that, we want you to stay well hydrated, make sure you keep pushing fluids. And if you have any problems maintaining your intake, be sure to let your doctor know, because there are other things we can do.